Tragically, we have now had 16 deaths among those who have tested positive for COVID-19. 68% of our deaths have been in people over the age 65. To date, all of the deaths in Pennsylvania have been in adults. Now I want to discuss our distribution of supplies to the healthcare system. We have been distributing supplies to hospitals, health systems, healthcare professionals, counties, and emergency responders statewide, including 678,630 of the N95 masks, 207,600 procedure masks, 380,000 gloves, 36,870 gowns used as personal protective equipment, and over 44,000 goggles and face protection. We are continuing to get more of these supplies from this federal stockpile, but we're also really scouring the state and the country to purchase whatever is available to make sure that our response teams and our healthcare personnel have a sufficient supply of the resources that they need to take care of patients with COVID-19. All of this information underscores the need for us to stay home as much as possible to prevent the spread of this virus. Our mitigation or prevention efforts are critical to prevent the spread of COVID-19 so that our healthcare system has time to prepare. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, the time that it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. Clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of this virus, COVID-19. If you have questions about your health, please contact your health care provider. If you or someone you know is experiencing a mental health crisis, contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. What is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I would like to turn things over to Governor Wolf. Governor?
Thank you, Secretary Levine, and thank you all again for joining me. You know, over the past few days, the number of COVID-19 cases, as Secretary Levine pointed out, cases in Pennsylvania, that number has skyrocketed. And this virus has a lag, so we're just now seeing people who contracted it as long as 2 weeks ago. The rapidity at which our case numbers are growing emphasizes the need for all of us to do our part to fight this disease. To get through this crisis, we're going to have to work together. We need to slow the spread of this virus, and we need to get the equipment needed to care for the people who do get sick. We know our hospitals will face capacity issues. We need more beds. We need more ventilators, more personal protective equipment, and so much more. And we need it as soon as possible because the virus is here. Yesterday, the state legislature approved a $50 million funding infusion into our healthcare system. And I am working to get this funding moving as quickly as I can. I want to thank our state legislature for moving so quickly on this. And I want to thank the federal government for the support they have provided so far. But the reality is we're just seeing the beginning of this crisis. We don't know how bad the surge will be or when this pandemic will end. So we must prepare ourselves mentally and physically to be in this for the long haul. We're not fighting a battle here, we're fighting a war. So we need to do everything we can to support our frontline medical workers. We need to ensure they have enough beds for all of their patients. We need to ensure they have the equipment to care for these patients so that they don't have to ration or make unimaginable choices about who receives care. And we need to make sure they have personal protective equipment to prevent themselves from becoming ill. This funding is a step in the right direction, but it won't be enough if we don't succeed in flattening the curve. We must do everything we can to prevent an enormous number of Pennsylvanians from becoming ill at the same time. And that means we must continue to distance ourselves socially. Just as doctors, nurses, and other healthcare workers have their part to play in this battle, so does each of us. I cannot express my gratitude enough to the medical professionals who will be fighting this virus on the front lines. But words are just words. So let's thank them through our actions. When we choose to stay home, we're thanking a medical professional. This virus can hide for 14 days, so we don't know who has it and isn't showing symptoms yet. We don't know if we have it and aren't showing symptoms yet. So we must act as if we all have it. This is the only way we can reduce the burden on the medical system. So please, let's all do our part to stop the spread. By working together, we can save lives. Thank you. April, back to you for questions.
Thank you, Governor. The first question is from Capital Wire for you. This morning, Labor and Industry released data showing nearly 650,000 Pennsylvanians have filed unemployment claims since mitigation efforts were implemented. With so many people filing claims in such a short period of time, has the department been able to keep up with the filings and process them in a timely manner? And do you know if there's any current backlog or delay?
That's a great question. We are working really hard to make sure that we do everything we can to process these claims as quickly as possible. I think the number that you mentioned is correct, but by the end of tomorrow, if you go back to March 15th, through the end of tomorrow, we are projecting that we're going to have around 800,000 new claims. That's about 10% of all the new claims in the United States. So Pennsylvania is really the epicenter of the unemployment insurance claims. And we're doing everything we can to make sure that we turn these things around as quickly as possible. We are not doing a perfect job yet, but we're working on it, and every day I think we're getting better at this.
Governor, from Penn Live, with the number of cases growing, at what point do you think you would make the call to cancel all in-person classes for K through 12 students for the remainder of the year, as Kansas and Virginia have done? Are we approaching that point?
Yeah, I want to keep that open. We have, as you know, yesterday, I guess I announced that we're extending the school closure for yet another 2 weeks starting next Monday. But at some point, I think your Penn Live is making an excellent point that we're going to have to decide what happens with the rest of the school year. So we're working with educators, and we'll continue to make sure that we're being fair to the students and the educators to make sure that we keep all of them safe.
Governor, from WTAJ, are other states have been deemed federal disaster areas, like New York, California, and Washington. What is the threshold needed before PA receives that designation?
Yeah, that's a great point. I think it depends on the severity of the crisis. So if you look at where the coronavirus has hit the hardest, it has been in Washington State, California State, and now New York State. And so it is no surprise that those are the ones that have been declared federal disaster areas. I'm not exactly sure what the precise definition of that is, but we apparently in Pennsylvania have not yet reached that threshold.
Dr. Levine, the next question is for you. Again, from Penn Live, what advice do you give people with underlying health conditions who are employed by a life-sustaining business? Should they continue reporting to work? What other options should they consider?
Well, I think that employees of any business that has been designated essential or life-sustaining should discuss their medical needs with their employer and discuss how serious their medical conditions might be, whether they're stable or unstable, and then make a decision with their employer and perhaps with their doctor about the best course of action to take.
Secretary, from the Associated Press, the Inquirer has a report that a triage policy for doctors is being worked up by the Health Department. Please describe its terms and how it's supposed to be implemented, and is it mandatory?
So we don't have a specific triage policy that is that we're implementing at this time. I mean, we're always triaging patients. That means that we're assessing what their needs are and then providing the appropriate care. But the crisis standards of care that we've been working on and working to implement with hospitals and health systems are very important in terms of utilization of supplies, of personnel, of beds, etc. But there's no specific decisions about who gets treated or who doesn't get treated, if that's the implication.
Secretary, from WHP, without a vaccine, your ability to get the message out is likely the most effective way to stop the spread of the virus and save lives. Can you talk about the importance of your communication teams and how they're getting the word out where Pennsylvanians are looking or listening for information?
I think that's a really important point. You're correct. There is no accepted standard of care for treatment of COVID-19, and there's no vaccine at this time. And so our communication with the public and with medical personnel, as the governor was saying, is just absolutely important, which is why we're having these daily press briefings, and the governor has been having regular press briefings, while we have press announcements that go out every day. We have a very big presence on social media as well, and we have absolutely fantastic communications team both in our department, in PIMA's department, and the governor's office to coordinate and get the message out about the importance of staying home in our mitigation efforts and the danger that COVID-19 presents.
Secretary, from WGAL, asking about essentially the mental health situation, about calls to the mental health hotline, and if you're concerned about economic anxiety matching the anxiety over COVID-19.
So I don't have a specific number that have been calling the hotline, but we want to make sure that people know about the hotline and can call or text if they're having difficulty. I am sure that there are many anxieties that people have during these very challenging times, and that includes anxieties about health and the health of themselves and their family and their loved ones and their neighbors, as well as the economic anxiety. And so, the governor, under his leadership, and the whole governor's office and team and the administration is working to do the very best we can to protect public health. And then the governor and the economic team are working on plans to stimulate the economy when we're able to come out of these very challenging times in terms of COVID-19.
Governor, the next question is for you. From Penn Live and News Talk 104.1, the questions are about non-emergency construction. Will there be a consideration for job sites of less than 10 workers moving forward? And some are concerned with leaving unfinished construction projects sit idle because they could create a hazard.
Yeah, I think, again, with our waiver process, we're trying to apply common sense here. There are also remodeling and construction jobs that where places need to put house wrap on or finish a structure so that it's not a problem, a safety hazard for the neighborhood. So I think we need to be smart about this and apply common sense. And it's one of those things that is not a broad one-size-fits-all answer. The idea is that if there is a need, if this is something that really has to be done, and it's something that we can do in a safe and sound manner, then we ought to proceed with it. But again, the overall goal here is to do everything we can to keep from bringing people together, to keep from congregating, to buy time for our healthcare system. If we don't succeed in this, we're not going to be able to do any of the things that we're like in remodeling or construction. We need to make sure that the first priority is to stem the tide of this disease and buy time.
Governor, we have several outlets asking about travel from New York City to Pennsylvania, specifically using Megabus and those operations, and whether or not you're considering suspending travel of those charter buses into Pennsylvania.
Yes, we are, and we actually just brought that up today. I believe, and Lindsay can make sure that I'm right on this, but we have already done things with charter bus services, regularly scheduled bus services that are coming in from states where there's a problem. That does pose an issue that we have to address. So we're doing that right now. I don't have an answer on what we're going to do about that. But again, everything we're trying to do here is to buy time. And to the extent anything we do, anything that's going on out there, anything that we haven't thought of that runs counter to the goal of buying time, to allow our healthcare system to build the capacity it needs, anything we do that jeopardizes that, we jeopardize our well-being and our safety. So this came up today, was brought to my attention by some legislators, and we got to work on that immediately.
Governor, for you from Spotlight, PA, will you pledge to release the full list of businesses granted or denied waivers in the interest of transparency?
We're also trying to do the best. And if I can be convinced that that's in the best interest of making sure that we're doing the right thing, I will do that. What I want is, again, I keep talking about this. The first thing we did was provide broad guidance as to which businesses were essential and which were not. But then, by design, we set up a waiver process, a formal waiver process that goes through the Department of Community and Economic Development to give businesses a chance to say, well, the broad categorization you made didn't actually account for this. And so we have a waiver process that says, okay, in this case, this company actually is doing something that could actually contribute to the safety and welfare of the people of Pennsylvania. In this case, not. So we've had thousands of waiver requests, and thousands have been, the waivers have been rejected, and thousands they've been approved, and a number of requests have come in really just to confirm that they are or are not eligible for this kind of an exemption. So I think the process is working well. I want to be as open and transparent as I can. I also don't want to make this process subject to all kinds of pressures that might make it work less well than I think it should. At this point, we're focused on consistency. We're focused on trying to make sure that we turn around waiver requests as quickly as possible, and we want to make sure that we're making the right calls on this. So these are things that we have to do. If I can be convinced that actually showing the entire list to the world as to what we're doing and in what format we ought to do that I would be very happy to do that. Secretary,
for you, we have a question from the Tribune Review and the Inquirer about dentists and dental groups in terms of the discussions that you're having with them and whether or not there's going to be a decision to restrict emergency dental procedures to facilities.
So we have been discussing this with the Dental Association and a number of the different dental schools. As I had mentioned previously, we had released guidance on Monday based upon the CDC guidance, but after hearing from many dentists, the Dental Association, many of the deans of the dental schools, we have been re-looking at that. We have come up with some new draft policies that I'll be discussing with dental experts this afternoon, and then we'll have a result that hopefully we can release tomorrow.
Secretary, we have some questions on flattening the curve. From WLVR, we're continuing to see the exponential rise in cases. just as you had warned would happen. Looking at the data, is the Public Health Department having any conversations about when this number could flatten?
Well, we don't know when it's going to flatten, and that is the purpose of the mitigation or prevention efforts that the governor has referenced. First, the schools, the non-essential or life-sustaining businesses, and then in the counties most affected, the stay-at-home orders. And so all of those are in an effort to bend that curve of the number of new cases that we are seeing. But they all take time in order to show progress. As the governor had referenced, people that are on our list today for positive cases might have had their test a day or so ago. They might have had their first symptoms a number of days ago, been exposed before that. So there's going to be a lag before we see evidence of the bending of that curve. So I don't know when it's going to be. I think it's going to be a very difficult number of weeks, but we are hopeful that we'll be able to see progress.
As a follow-up to that, Secretary, the Wilkes-Barre Sentinel is asking, over the past week, the ratio of positive to negative results has remained roughly the same. Wouldn't this support the idea that the virus isn't spreading as fast, only looking at new positive cases?
No, I really think that we're seeing new positive cases, although we're always seeing a collection of laboratory results that were collected over time, depending upon the waiting period before we see a test. And then there's the incubation period. But no, I am really convinced that we are seeing that continued exponential rise and the doubling of new cases, as has been seen in other states and in the United States in general. And then we're working with these mitigation efforts to bend the curve.
Secretary, from the Post-Gazette, do you have any evidence that social distancing is working in Pennsylvania?
We don't have evidence yet in Pennsylvania. There has been evidence in other countries, and then perhaps in the first states that were hit, in California and Washington, that social distancing is effective. But again, there's weeks of lag time before you're going to see that impact.
This question is from the Pittsburgh Business Times. We'll start with Secretary and then go to Governor. Secretary and Governor, can you talk more about help to hospitals and healthcare systems? Some, even before COVID-19, were losing money and closing, getting through this crisis with just not enough supplies, but also funding and staffing and other needs. This will be a major hit to them on top of all previous challenges. Can you discuss a little about how you're working with those hospital systems?
Mm-hmm. Well, from my perspective, and I'll ask the governor to step in, is that we have been working them to supply the resources that they need. Resources through our departmental stores, resources through the national stockpile, and then other resources that we're looking to purchase, actually, and then give to hospitals, health systems, emergency responders, et cetera. And we're working to support them in any way with all of the different measures, such as supplies, working with them on their staffing needs, working to make sure there's enough beds available, and then those standards of care. But then there's the new legislative money that I'm sure the governor will speak to. Governor?
Yeah, no, I think Secretary Levine is right. This is something that we have to pay attention to. The federal stimulus bill includes a lot of money for hospitals. The $50 million that the General Assembly here in Pennsylvania appropriated is to make sure our healthcare system, to add at least, to contribute to the ability of our healthcare system to have the capacity. And of course, we undermine that to a certain extent. We're asking hospitals not to engage in elective surgeries, elective treatments, which is a negative effect on cash flow in an industry that has been feeling some stress. But right now, with the amount of demand that is likely to occur as a result of this virus, the problems that hospitals have had in the past of trying to make sure that patient levels are high enough to keep them in business, that doesn't seem like that's going to be a problem. What we need to make sure through Medicaid, through the block appropriations of money at the federal and state levels, that we're doing our bit to support these institutions so that they have the resources they need to stay open. We need them to stay open, and at the federal and state and local levels, we're doing everything we can to make sure that we support them in this effort, wherever they are, urban areas, rural areas, all across the state.
Governor, from News Talk 104.1, are there counties that are being considered for stay-at-home orders due to community spread?
Every day we take a look at the counties across Pennsylvania. Again, what we've been trying to do is bring a measured approach, not a one-size-fits-all approach to the coronavirus epidemic in Pennsylvania. So we have had stay-at-home orders in those counties that have been the hardest hit, and we continue to look at that every day, actually within the day, many times during the day. So we'll continue to do that. And don't forget, we've also had statewide things like the closure of schools, the closure of businesses. Those are not just in selected counties. Those are all across the state. So we look at what we're doing all the time, and if we learn something from one group of people that we ought to be taking a look at, something that we ought to be doing differently, we take those things seriously. So we're always re-examining what we're doing to see that we're doing the best we possibly can.
For Dr. Levine, from the Altoona Mirror, they're asking about how to discuss how standards of care can change if there's an overwhelming surge.
Well, we have been discussing about the many different resources that hospitals and health systems will need. So that includes staffing of healthcare professionals, so physicians, but also nurse practitioners and physician assistants, nurses, respiratory therapists, radiation technicians, all of the above that will be necessary. And we're also looking at beds. So there are intensive care beds for the sickest patients. There are specific infection control beds that have certain ventilation systems to prevent the spread of infection. Then there are traditional what are called med-surg beds or medical surgery beds, traditional hospital beds, and then subacute beds. We'll be working with the hospitals and health systems to allocate those different types of beds depending upon the needs that they're seeing with patients with COVID-19. And then we're looking at outside-the-box ideas to expand beds. So we've waived regulations so hospitals can add perhaps traditional beds in areas and rooms that weren't usually used for patient care. Then we're looking at repurposing ambulatory surgical facilities. As the governor said, we have ordered that hospitals and health systems stop elective procedures to prioritize beds and personal protective equipment. So we might use ambulatory surgical facilities as beds. And then even hotels might be used for more subacute beds for convalescence for patients as they finish their recovery. And so we're going to be looking at the standards of care, meaning where patients might be transferred to and where they might be in that continuum of care.
Secretary, the last question that we have time for today from the morning call, can you give an update on the status of funding to keep Easton Hospital open?
So the administration is working with all of our different departments to look at every possible way to keep that hospital open. It'll be essential that all of our acute care hospitals are open to care for patients with COVID-19 in those areas. And so I don't have the specifics yet, but we'll be working to keep that hospital open to help us deal with this epidemic and public health crisis.
Thank you, Secretary. Those are all the questions we have time. I'm sorry, go ahead.
No, just let me add to that. I think the Secretary is making an excellent point. We will do what we can to keep the Easton Hospital open. We need to keep our hospitals operating in this very important time.
Thank you so much, Governor. And that concludes our briefing for today. For reporters whose questions we were not able to get to, the Department of Health and the Governor's Communications Offices will follow up with you. Thank you so much, and we will be back to you tomorrow with another briefing.